In the past 2 months, since COVID-19 vaccines were rolled out in the United States, there have been a few cases of severe bleeding in recipients of the mRNA vaccines. A 56-year-old physician from Florida developed symptoms of bleeding 3 days after he received his first dose of the Pfizer-BioNTech vaccine. His platelet count dropped to zero and he died from a brain hemorrhage in early January, 2 weeks after vaccination. Another case, a 72-year-old woman from New York developed bruises on her extremities and bleeding disorders inside her mouth 1 day after she received her first dose of the maternal vaccine. She was hospitalized the same day on January the 19th. Her platelet count was at zero at the hospital. She was found to have a severe immune thrombocytopenia. This medical condition occurs when one's immune system attacks and destroys one's own platelets, resulting in a low platelet count. The woman recovered with treatment. Similarly, a 48-year-old woman from Texas received her first dose of the maternal vaccine on January the 3rd. She subsequently noticed red spots on her wrists and ankles, which she did not pay too much attention to. 2 weeks after her vaccination, she developed heavy vaginal bleeding and went to the emergency room. Her platelet count was found to be zero, although she had a completely normal blood count less than a week before she got her mRNA vaccine. For 4 days during her hospitalization, she was treated with platelet transfusions, immune globulins, and steroids to bump up her platelet count. She recovered uneventfully. She later stated that if she had not recognized the danger signs of bleeding, such as the red spots on her skin, she would have gone to the emergency much sooner. Briefly, platelets are one type of cell in the human circulation system, along with white blood cells and red blood cells. A major function of platelets is to promote blood clots and prevent bleeding. When blood vessels are broken, platelets are activated and release thromboxane A2 and serotonin, which cause spasms in broken blood vessels. The activated platelets also aggregate together to form temporary platelet plugs to stop bleeding. In addition, they secrete clotting factors to enhance blood coagulation. A normal platelet count ranges from 150,000 to 450,000 per microliter of blood. If it is less than 150,000, it is called thrombocytopenia. If it is below 50,000, the risk of bleeding can be significantly increased. A platelet count under 10,000 is considered very serious and needs immediate medical attention. Many medications, chemicals, and medical conditions can cause thrombocytopenia. Medications such as heparin, quinine, some antibiotics, naproxen, or ibuprofen, etc., can trigger low platelet count. Viral or bacterial infections, alcohol, cirrhosis, and a deficiency in iron, vitamin B12, or folic acid, etc., can also cause thrombocytopenia. What about mRNA vaccines? Can they also cause thrombocytopenia or bleeding? Let us analyze the current data. In the past 7 weeks, 36 cases of thrombocytopenia have been reported to the Vaccine Adverse Event Reporting System through the end of January. The incidence of thrombocytopenia in vaccinated people did not appear higher than the rates normally found in the general population. So the cases of low platelet count and bleeding among the recipients of the COVID vaccines are likely just coincidental. So far, more than 60 million doses of mRNA vaccines have been administered in the United States. The incidence of thrombocytopenia and bleeding is extremely low after vaccination. However, The bleeding, if occurring, can be serious. If you have any of the following signs or symptoms after receiving the vaccine, you should call your doctor as soon as possible. If you have any minor bleeding or are confirmed to have thrombocytopenia after vaccination, you should avoid drinking alcohol or take pain pills such as naproxen or ibuprofen because alcohol and these pain medications can cause and aggravate low platelet count. You should also take other precautions to prevent and alleviate the bleeding. Use extra soft toothbrush and brush gently. Blow your nose gently. Be careful when using sharp tools such as scissors, knives, or needles. Shave with an electric razor. Do not walk around with bare feet. In summary, low platelet count and bleeding after COVID vaccination could be coincidental, and the cases are very rare. However, the bleeding can be serious. You should seek immediate medical help if you notice any signs or symptoms of bleeding after receiving the COVID-19 vaccines.